Hello and welcome to the Reasonable and Prudent Parenting Standard training. This training is for current licensed foster parents and prospective foster parents going through the licensing process. If you have not already printed off the Reasonable and Prudent Parenting Standard Caregiver Training Note Sheet, which is located below the link to this training, please pause this training to do so now. The note sheet will need to be completed and turned into your certification worker in order for you to receive credit for completing this training. By the end of this training, you will be able to define what the reasonable and prudent parenting standard is, explain why normalcy is important, list the criteria used to determine if a foster child can participate in an activity, and apply the standard to common activities. According to the Preventing Sex Trafficking and Strengthening Families Act, caregivers are allowed to make parental decisions based on a reasonable and prudent parent standard in order to maintain the health, safety, and best interest of a foster child and to also make decisions that support normalcy for the children. Here are descriptions of the roles that foster care workers and certification workers play in the implementation of the law. Your caseworker should be having conversations with you and your foster child about the activities that are available for the child to participate in, and your licensing worker will ensure that you have completed this training and have the appropriate knowledge and skills to make careful and thoughtful parenting decisions. The reasonable and prudent parent standard is defined as the careful and sensible parental decisions to maintain the health, safety, and best interest of a child while encouraging the emotional and developmental growth. The caregiver shall use the standard when determining whether to allow a child in foster care to participate in extracurricular, enrichment, cultural, and social activities. Here are the applicable licensing rules that support the standard. We may ask, why is normalcy important? Normalcy is an important component of well-being for children and youth in foster care in order to ensure that they are able to have normal experiences and engage in activities that are age appropriate and allow them to grow. Normalcy for children means being able to do what is considered routine, such as participate in sports, teams, clubs, choir, dance classes, volunteer, spend time with friends, have sleepovers, and take trips. It also includes opportunities for youth to take on additional responsibilities and freedoms, such as learning how to drive, working a part-time job, or having a curfew as the child approaches adulthood. Through these activities, youth learn their interests and talents, safely experiment and take risks, practice decision-making skills, and develop healthy peer and adult relationships. In determining if an activity or opportunity is appropriate for a foster child to participate in, several factors need to be taken into consideration. Caregivers and the designated individual in a residential setting need to determine the overall age, maturity, and developmental level of the child, potential risks and appropriateness of the activity, federal and state laws and licensing requirements, best interest of the child, importance of encouraging the child's emotional and developmental growth, importance of providing the child with the most family-like experience, and the child's behavioral history. Deciding these factors can be challenging and subjective. Let's take a look at a few examples to see how the standard is applied to real-life situations. First example, a 16-year-old child, James, brings home a permission slip to attend a school field trip during the day to a museum several hours away, but within the state. James has been in the foster home for 3 months and things have been going well. What should the foster parent do? A. The caregiver can use the reasonable and prudent parent standard to make a decision. Or B. This is a decision that cannot be made by the caregiver and requires further approval. The answer is A. The foster parent must consider factors such as the potential risk, appropriateness of the activity, and the best interest of the child. As shown earlier on the determining factors slide, some questions to ask to help with this answer could be, what is your child's maturity? What could happen if the child's involved? Are there any federal or state laws regarding this activity? Are there any licensing requirements? How would this benefit the child? How will your child emotionally grow? How does this provide a family-like experience? How has the child been acting with you and when away from you? Example 2. A child's mother calls a caseworker, upset that the foster parent signed her 7-year-old son up to participate on a t-ball team and did not get her permission. The foster parent has 2 other children that are also going to participate on the team. A. The caregiver can use the reasonable and prudent parent standard to make a decision. Or B. This is a decision that cannot be made by the caregiver and requires further approval. The answer is A. While playing sports has risks, but if it's developmentally appropriate, it's within the standard of decision making for the extracurricular activities. The foster parent could have a discussion with the mother about the team and invite her to attend practices or games if appropriate. A foster parent, Michelle, would like to take her niece 14 and nephew 16, who have been placed with her, to Cedar Point in Ohio. The children's parents have taken them there before, so Michelle doesn't think that they will mind. What should the foster parent do? A. Michelle can use the reasonable and prudent parent standard to make a decision and take the children. B. This is a decision that requires further approval. Or C. Since the trip is out of state, Michelle is not allowed to take the children. The answer is B. Out-of-state travel requires prior approval. Michelle should talk with her caseworker to see if just obtaining parental approval is fine, or if the local court also requires authorization. 12-year-old Mackenzie wants to go to her friend Ava's house on Friday to spend the night. The foster parent has met Ava's parents once at a school activity, and Ava appears well cared for. What should the foster parent do? A. Ava's parents seem nice. The foster parent should let Mackenzie spend the night. B. Call Mackenzie's caseworker to ask, but decide not to let her go because it's Friday and the foster parent did not hear back from the caseworker. C. Talk to Ava's parents to get more information about what the girls will be doing and who will be supervising before they make a decision. The answer is C. If the foster parent feels comfortable after talking to Ava's parents and has reviewed the factors that should be considered when making the standard, they can approve Mackenzie to spend the night. Lucas, 13, wants to spend the night at a friend's house where they will be riding four-wheelers. Lucas says his friend rides them all the time and he promises to wear a helmet and be safe. What should the foster parent do? A. Due to Lucas's age, he is not permitted to operate a four-wheeler without a valid off-road safety certification and direct supervision of an adult. B. Call the friend's parents to get more information. C. Trust that Lucas will make safe choices and wear a helmet. The best answer is A. Foster parents must comply with all laws and ensure that foster children have the required safety training before permitting them to participate in an activity. Alexander, 12, wants to go hunting with his foster father, who is an avid hunter. What should the foster parents do? A. Sign Alexander up for hunter safety class to get his hunter safety education certificate. B. Tell Alexander no. Foster children cannot go hunting. C. This is a decision that cannot be made by a caregiver alone and requires further discussion and approval. The answer is C. Hunting and gun use requires further discussion and approval from the caseworker and parents, if applicable. If agreed upon and the child is found to be appropriate to go hunting, all laws must be followed and the hunting certificate and license must be obtained. The Green family wants to take an overnight trip up north to their cabin with their 3 foster children. They plan to go out on their motorboat if the weather is nice. The trip would not interfere with any parenting or sibling visitations. Can the Green family make this decision? A. No. Since the foster family will be boating, this is not a decision they can make. B. No. The foster family cannot leave overnight without approval. C. Yes. This is a decision that falls within the reasonable and prudent parent standard. The answer is C. As long as the Green family is not leaving for over 48 hours and are complying with all boater safety rules and proper life jacket use, they can take the children on the trip. Kevin, 14, wants to use his laptop to connect to the foster family's internet for checking his email, social media, and general internet use. Can the foster parents allow Kevin to use the internet? A. Yes, this is a decision that falls within the reasonable and prudent parent standard. Or B. This is not a reasonable decision to be made by the caregivers. The answer is A. The foster parent should discuss house rules such as hours and daily length of time allowed. The foster parents must consider the child's age and development when establishing guidelines and supervision for use. There should be regular and ongoing conversations about the safe and appropriate internet use and risks of providing personal information on the internet via email or social networking sites. Amber just turned 13, and she wants to ride the bus to her foster home after school, where she would be alone for 2 hours until her foster mom, Rose, got home. Can Rose make this decision to allow Amber to stay home alone? A. No. This is not a reasonable decision to be made by a foster parent. B. No. Amber is not old enough to stay home alone. C. Yes, this falls within the reasonable and prudent parent standard. The answer is C. Rose must use the factors that should be considered when making this decision. If Rose feels that Amber is developmentally appropriate and has demonstrated responsibility and good decision-making skills, then she can permit Amber to stay home alone for short periods. Rose must help Amber develop a safety plan to include emergency numbers, procedures, and allow contact with the foster parent. Rose should also set safety parameters around things such as activities that Amber can or cannot do, such as answering the door and having friends over. Abby, age 9, has expressed to her foster parents that she would like to go to church with her friend Danielle from school. Abby has been placed with the foster parents for 9 months, and her parents have never expressed a specific religious preference. Which decision should the foster parents make? A. This is not a decision to be made by the foster parents. They should contact the caseworker. B. This falls within the reasonable and prudent parent standard decision making. If they feel safe letting Abby go with Danielle's parents, they can let her go. C. Danielle's church is not the same denomination as the foster family's church, so they decide not to let Abby go. The answer is B. The foster parents should talk with Danielle's parents to ensure that they feel comfortable allowing Abby to go with them. There are many situations and activities beyond the examples we have looked at today that fall into the reasonable and prudent parenting standard. As you have seen, some of the activities need prior approval from DHHS, the court, and or the child's parents. Here are some examples of activities that require prior approval. Any activities or events over 48 hours. Any events or activities that are out of state. Participation in religious or cultural practices outside of the legal parent's chosen religion. Hunting. Range shooting or target practice. Children riding as a passenger with an adult on a motorcycle or moped. Children operating motorized equipment or a vehicle. They must also follow age requirements and have proper training or certification. Driver's licenses. Only a parent or guardian can sign for an application. Entering the military. Haircuts that change the child's appearance. Permanent hair color, piercings, tattoos, and a baby's first haircut. Although we have touched on the reasonable and prudent parenting standard today and have discussed some examples of how it is applied, there are numerous other situations that may arise that have not been covered. Please refer to the DHS 5331 Caregiver Guidelines for Reasonable and Prudent Parent Standard for additional clarification. This can be found on the Michigan Department of Health and Human Services webpage. The Caregiver Guide also provides a list of applicable references that can be of assistance, such as the Boater Safety, Off-Road Vehicle, All-Terrain Vehicle, and Hunter Safety Handbooks. Always remember, You can always talk with your caseworker or licensing worker for more help with specific situations. Understanding how to apply the reasonable and prudent parent standard is important to normalcy for our foster youth. Normalcy is an important component of well-being to ensure that foster children are able to have normal experiences and engage in activities that are age appropriate and allow them to grow. Throughout this training, several examples have been used to show how the standard should be applied in everyday experiences. Although every potential situation could not be covered in a training session, knowing where to get additional information is critical. Congratulations on completing the Reasonable and Prudent Parenting Standard training. Please turn your notes into your licensing worker to receive credit for completing this course.